Health news now. This month is American Stroke Month to learn about the warning signs of a stroke and what you can do to prevent it. WSFA 12 News reporter Bethany Davis is live this morning at Jackson Hospital. Bethany, strokes impact so many people.
Listen, a stroke can happen to anyone at any age, and then having a stroke puts you at an even greater risk for having a second stroke. Dr. Tijal Agarwal is a neurologist here at Jackson. Let's explain exactly what happens when a stroke occurs. What happens to our brain?
Yeah, so let me explain. So stroke is a neurological condition which is usually caused by lack of blood supply to part of the brain. And there are usually two kinds of stroke. One of them can happen because of a blood clot in a blood vessel that supplies the brain. And the other type is called hemorrhagic stroke, which is usually caused by a rupture of blood vessel in the brain. So when that happens, usually even within seconds to minutes, your brain cells start to die, and it can impact bodily functions that are controlled by that part of the brain.
So we know that obviously every second counts. What are some red flags? What do we need to be on the lookout for to recognize a stroke?
Yeah, so it's really important to recognize some of the important signs and symptoms of a stroke so you can respond in a timely manner. As I always say, time is brain when it comes to stroke. So some of the important signs to look out for are sudden changes in your speech, like trouble speaking or slurred speech, or sudden changes in your vision, like difficulty seeing or loss of vision, sudden onset of weakness on one side of the body or the other, sudden loss of balance or change in your coordination. So always look out on some of these warning signs, and if you ever think you're having it or someone you know is experiencing these signs, it's always a good idea to call 911 right away.
There are some things we can do, some steps we can take to at least help our chances, right, to prevent a stroke. What are some of those things?
And that's a very good point. Usually a lot of strokes are preventable if you follow good lifestyle measures and try to control your risk factors. So some of the common risk factors that you can try to control are diabetes, which can have a significant impact on outcome of a stroke, along with high blood pressure, hypertension. Some of the lifestyle changes that you can make is always, again, no smoking, not drinking too much alcohol, again, maintaining an active lifestyle, or at least trying to walk 30 minutes every day, and eating a healthier and balanced diet.
Yeah, well, because time is so much of the essence, and every second does count. We're going to talk a little bit more about some of those signs and symptoms, things you need to be on the lookout for in yourself and in others, so you can recognize a stroke when it happens and make sure you get treatment fast.
All right, Bethany, we'll get a link for you to learn more about stopping and preventing a stroke on our website, WSFA.com.